Okay, so the first thing I'm going to do before I give any injection is acknowledge the safe injection considerations. So the first thing you would do is assess the accuracy and the completeness of the MAR. So you would go on, make sure that the right medication is ordered from the physician, and then just double check that the medication that's brought up is the same one that's on the MAR. Next, you would identify the 8 rights, which are patient, dose, route, time, documentation, reason, and response. And after you do that, you would just confirm any allergies. So in this case, Mr. Mancini has an allergy to codeine, so we would also take that into consideration. Okay, so Mr. Mancini is like an average adult male, so he has like an average BMI for his age and gender, so and like his muscle mass and like fat distribution is all normal. So I'm just gonna use like the typical needle gauge sizes. So for the IM injection, I'm gonna use a 22 gauge. The normal range is 20 to 25, so this is right in the middle. And for the sub-Q injection, I'm gonna use a 25 gauge, which is a little on the higher side because the normal is 27 to 25, but this is the one I have available and it's still in the range. So yeah, those are the 2 sizes we're gonna use. In terms of syringe size, for the IM injection, we did the calculations and we're gonna be giving 0.5 milliliters. So you always wanna go with the smallest syringe size that you can find, just so that it's more accurate. So I'm gonna be using a 1 milliliter syringe. And for the heparin, which is the sub-Q injection, we're gonna be giving 1 milliliter, which is 5,000 units, but we're gonna use, again, just a 1 milliliter syringe to be the most accurate that we can. Before I prepare my needles and syringes, I'm just gonna do hand hygiene, which I'm pretending because I don't actually have hand sanitizer right now. Okay, I have all my supplies laid out here for me. So I have the Haldol and Heparin. So the first one I'm gonna draw up is the Haldol. So I'm gonna open up the top, and I'm just gonna clean the top with a alcohol swab. And I'm going to put a blunt tip needle on the syringe just to draw it up with so I don't damage the actual needle. So we're gonna be drawing up 0.5 milliliters. So what I'm gonna do is take 0.5 milliliters of air in my syringe and push it into the vial just so I can get some pressure so I'm able to draw back the medication easy. So I'm gonna push the air in, and then I'm gonna draw out 0.5 milliliters. And there's an air bubble in there. Hold on, there's a lot of air in there. There, so now I have 0.5 milliliters, and I'm gonna put the sheath back on. So I'm just gonna put a label on this since we're drawing up 2 medications so I don't get them confused. So I wrote the patient, the drug, and how much is drawn up in here. So I'm just gonna put that off to the side now. Okay, I'm gonna draw up the heparin now. So this is the sub-Q injection, and we're drawing up 1 milliliter. So I'm gonna do the same thing, open it up, and clean the top. So I'm drawing it up with a blunt syringe. So we're giving 1 milliliter of heparin, so I'm gonna inject 1 milliliter of air into the syringe. And I'm just gonna label this one as well. I have to switch over the blunt tips to the actual needles I'm gonna be injecting with. So I'm putting on a 22 gauge on the Haldol injection because that's our IM needle. So I'm gonna switch them over now. And leave the safety cover on. And I'm putting on a 25 gauge needle for the sub-Q injection, which is the heparin. And now these would go into the sharps container. So before I give the injection, I'm gonna do hand hygiene again, and then put on gloves, and then I'm gonna verbalize what I'm doing to my patient. So hi, Mr. Mancini, I'm gonna be giving you 2 injections now. The first one I'm gonna be giving you is gonna go in your stomach, in your lower abdomen, and it's just a subcutaneous injection. It's your heparin, okay? So I just wanna double check your wristband one more time before I give it. So once I've checked it, I'm ready to give the subcutaneous injection. So I'm gonna clean the area first with alcohol. And I'm gonna take the heparin and take the cover off. So for subcutaneous injections, you want to pinch the skin and put it in at a 45-degree angle. So I'm gonna pinch the skin here, put it in all the way, and then just push it in. I'm gonna take it out and put the shield back on. Okay, Mr. Mancini, it's time for your intramuscular injection now. So this is the Haldol. So to landmark an intramuscular injection in the arm, you find the acromion process, which is like the knobby part of your shoulder, and you just go 2 finger widths down right in the middle, and that's where you would give the injection. So first I'm gonna clean the area. So let's just say I've landmarked already. I'm gonna clean the area. And get ready to inject it. So an IM injection is gonna go in at a 90-degree angle, and instead of pinching the skin, you're gonna spread it apart. So I'm gonna spread the skin, put it in at a 90-degree angle, and I'm gonna pull back a little bit just to make sure I'm not in a blood vessel. And if I don't see any blood, I'm good to inject the full amount. And then you put the cover back on. So once I'm done the injections, the needle, syringe, everything goes into the sharps container, and the alcohol swabs and labels can just go in the garbage. After performing my injections, I would go document and chart that I've done it, and just make sure that I'm documenting the correct amount, route, and all the 8 rights of administration.